Good evening, everybody. Today I will be covering the neurology section with Scenario 12. Neurology is a form of medical science that concerns itself with diseases and or disorders of the nervous system. There are billions of neurons in the brain that act on impulses, receiving and transmitting. The subject alone involves the central nervous system, in the peripheral and automatic nervous system, as well as certain disorders scaling from degenerative diseases and possibly even birth defects. Together, the physical therapists and physical therapist assistants have the opportunity to work together and learn about patient disorders and how to provide that aid. For example, a special interest group for neurology would be a particular degenerative disease known as Lewy body disease. As a PT or a PTA, it would come to the understanding that the disease is a form of dementia, like Alzheimer's, found within the brain. And certain movement symptoms appear like hunched posture, rigid muscles, shuffling walk, and trouble initiating those movements. But there are medications to help with that, such as antidepressants, antipsychotic drugs, and cholinesterase inhibitors. Now, as a result, and stating earlier, it's come to the conclusion that the patient cannot do much by themselves, so they must rely on the PT or the PTA for daily activities. Now, for Scenario 12, it does state, your patient's physical therapy treatments are being denied. The insurance reports that they will not pay for the physical therapy charges because they are treatments for a pre-existing condition. In other words, the patient had the condition before signing up for the insurance. As mentioned earlier, since the patient cannot do much for themselves, it is the responsibility of the PTA who is informed of the predicament to take that course of action. It's their professional duty, as well as the accountability and integrity of the PTA to provide those services and assist the patient, so they must accept the responsibility of their needs, and they must stick by the rules as to remain truthful and honorable for the patient. Now, the main law that's being broken right now is the ACA, or the Affordable Care Act, for it doesn't matter if the patient had a pre-existing condition, the matters still apply where the patient can receive the insurance for their complications. Now, if the PTA is the only one aware of this, they are liable to take some course of action. They can submit a complaint to the PT, while the PT can discuss to their superiors about the law problem and possibly even inform the patient's family to help with the discussion. And all that can roll over to probably even a court case because of the denial of the insurance for the patient's need in their critical condition. As stated earlier, from the accountability, the integrity for the PTA, it revolves around the Code of Ethics. And the Code of Ethics that take action are listing from the principles 2, 3, 4, and 5. However, doing the right thing, doing the right intention doesn't start with the Code of Ethics. They are more of a guideline to project a healthy outcome to prevent harsh results, such as the court case, to the patient who can't help themselves. Remaining positive is a key feature, but the real detail that matters is standing up and remaining truthful to and for the patient and their safety. If the PTA chose to ignore or act like it didn't happen, a snowball effect of many future negative conclusions would have unfolded. The physical therapist would be completely lost during that entire situation. The patient's life would be at great risk because their medication is nowhere to be provided. At the end, more than likely the patient would pass away. The organization taking care of those patients would be caught in between the law by accident. And if they discover that the PTA who knew the entire time about the situation chose to ignore the problem or did not choose to acknowledge it, their license can be revoked, they can be fired, and more than likely the patient's family will take them to court. Overall, the entire case can be a handful, and it will be stressful for those who are aware and they need to take action. Being responsible isn't easy. Taking that initiative requires a lot of work, especially when someone's life is on the line. So it's a matter of remaining truthful and abiding by the law to do what is right.